Rinne's and Weber hearing tests. These tests are very important in order to differentiate between the type of hearing loss, conductive or sensorineural. In today's presentation, we will talk about the findings of these tests, causes of hearing loss, and in the end, we will do an exercise for better understanding. For the healthy ear, if Rinne test shows ear conduction better than bone conduction, then we say Rinne is positive. It means the ear is healthy. Do not confuse yourself with positive Rinne's being having a hearing loss. If bone conduction is better than ear conduction, then Rinne is negative. That is abnormal finding. It means patient has some hearing loss in the affected ear. Coming to the Weber, if patient has unilateral sensorineural hearing loss, then Weber will lateralize to the unaffected ear, which is the normal ear. If it is unilateral conductive hair loss, then it will localize to affected side, which is the problematic side. So there are two learning points. Number one, Rinne will be positive in normal ear, and then if Weber lateralizes to certain side, that side might have conductive hearing loss or the other side might have sensorineural hearing loss. So in normal case, Rinne show ear conduction better than bone conduction. It means Rinne is positive in healthy ear. Weber will be in a midline. In conductive hearing loss, bone conduction will be better than ear conduction in abnormal ear, which means that Rinne will be negative on the abnormal side. When we do Weber, Weber will lateralize to the abnormal side. So the learning point is Weber loves conduction. So Weber lateralizing to abnormal side, bone conduction better than ear conduction on the abnormal side. So the conductive deafness on the abnormal side, whichever ear the patient is coming. Coming to the sensorineural hearing loss, if Rinne is showing ear conduction better than bone conduction, there are two possibilities, either normal, either falsely normal, which is false positive. So now the Weber will differentiate either it is sensory or it is conductive. So when we do Weber, if Weber is going towards the unaffected side, it means the affected side has sensorineural hearing loss. So in order to revise important points, healthy ear will show Rinne positive and Weber will be in midline. That is a healthy ear. If patient has conductive hearing loss, then Rinne, for example, in the right ear, then Rinne is negative on the right side and Weber lateralizes also towards the right side. So it means right side has conductive hearing loss. Coming to the sensorineural hearing loss, for example, again on the right side, Rinne on the right side may show normal finding or positive finding. However, Weber will lateralize to the left ear. It means the right side will have sensorineural hearing loss. So here are the causes for conductive and sensorineural hearing loss. Remember, external and middle ear leads to conductive hearing loss, and any problem in internal ear will lead to sensorineural hearing loss. So coming to an exercise for the better understanding. So we have an 80-year-old male who presents with 4-month history of hearing loss affecting his left ear. So the left ear has a problem. On examination, you note that there is a hard impacted wax in the external auditory canal on the affected side, on the left side. So what will be the hearing test? So Rinne will show bone conduction better than ear conduction on the affected side, and Weber will also lateralize to the left side. So it means conductive hearing loss. It's very easy. Now coming to the question number 2, we have a 30-year-old male who presents with sudden hearing loss on right side, on the right ear. He denies any upper respiratory tract infections or any symptoms. When we do examination, it shows that ear is completely fine. When we do the test, Weber test lateralizes towards the left side. So we will explain it. Affected side is the right side. Rinne is not given, so we are not sure about it. Weber, it shows that it lateralizes to the normal ear or towards the left side. It means it's not midline, there is some problem. And we know that Weber always loved conduction. So the way it's going, it shows that that side has a conductive loss or opposite side has a sensorineural hearing loss. So I will further explain it here. Right side is the affected side and the left side has a Weber positive. So it means right side, which is an affected side, has sensorineural hearing loss. Reason could be acoustic neuroma, for which MRI is done in order to rule out the pathology. Question number 3. 50-year-old patient comes with a hearing problem. In that patient, we do Weber, and Weber can be heard loudest in the left ear. And when we do Rinne, Rinne test shows bone conduction is better than air conduction in the affected side, that is the left ear. So the affected side is left ear. Rinne is bone conduction better than air conduction on the affected side, and the Weber also lateralizes to the affected side. So the left side has a conductive hearing loss.